Okay, good morning, everyone, and welcome to our webinar this morning. We are joined by several representatives from our primary doc and primary partners to go ahead and discuss some of the benefits that they offer. Just a couple of housekeeping tips before we go ahead and get started. I want to apologize, my dogs are like going crazy over here because of course Murphy's Law. Any questions that you have, go ahead and put that in either the Q&A feature or the chat feature, and we'll go ahead and we will ask those throughout or at the end of the session. And then I just want to go ahead and introduce our speaker. Our speaker is Joan Phelps. She's the Director of Member Experience with Empowering Benefits. Joan's 30-year professional background has focused on health education and the business of healthcare, starting with managing a company offering one of the first pharmaceutical-grade skincare lines developed by two leading cosmetic dermatologists in New Jersey. In Florida, Joan continued her career in the medical aesthetic field as executive director of a prominent hair restoration practice, followed by developing an age management practice specializing in bioidentical hormone replacement pellet therapy. She then broadened her reach to aesthetic providers throughout the country as a medical aesthetic business consultant. As a founding member of Empowering Benefits since 2014, Joan combines her expertise in business development and health and wellness education in her role as Director of Member Experience, including oversight of the MPB Concierge team. Most recently, Joan has acted as advisor to the Our Primary Doc program and joins the OPD team in their enthusiasm for this outstanding healthcare solution. Go ahead, Joan.
Thank you so much. Hello, everyone, and welcome to our presentation. We're here with you today to introduce you to a truly innovative program called Our Primary Doc. Empowering Benefits, a national marketing organization, has partnered with the Primary Partners Alliance to develop Our Primary Doc. Primary Partners, a #1 ranked accountable care organization in the state of Florida, consists of a clinically integrated network of primary care physicians and specialists. The Our Primary Doc program includes the Primary Partners Direct Primary Care Medical Model and a non-insurance-based healthcare plan designed by Empowering Benefits. This plan features medical cost sharing as well as an array of supporting services. Our Primary Doc solves the challenges of rising healthcare costs by bundling the benefits of Primary Partners Direct Care Program with Empowering Benefits Medical Cost Sharing Plan. So why offer Our Primary Doc to your employees? In the current employment environment, where competition is fiercer than ever for quality employees, you'll have an advantage on attracting and retaining quality candidates by offering Our Primary Doc, which provides a full complement of services to address all their healthcare needs. You'll see impressive savings in benefits cost with Our Primary Doc, while providing your employees with an extremely effective healthcare solution for themselves and their families. The OPD healthcare benefit offers a transparent, predictable fee schedule with no surprise expenses. Since Our Primary Doc is a non-insurance-based program, it does not require your time and effort, as does the more involved administration of a traditional healthcare benefit. Our Primary Doc offers another option to employees who are health-focused and prefer to control their own healthcare costs. The OPD team educates and guides your employees, so you don't have to. Employees can now affordably provide healthcare to their families. Employees can select from an entire network of local OPD providers. Let's now discuss the services that comprise the Our Primary Doc program. Primary Partners Direct Care is more commonly known as Direct Primary Care, or DPC. DPC is a medical model where a practice offers patients a full range of primary care services under a membership contract in one all-inclusive, affordable monthly recurring fee. These services include routine care, regular checkups, preventive care, and care coordination. So what are the benefits to the patients? Since the patients are invested in this program and do not have to incur additional expenses such as office visit or other traditionally required healthcare fees, they're motivated to seek care when needed, which results in better outcomes. A member does not have the extra expense of office visit fees or any other fee requirements when visiting their primary care provider's office. Membership provides unrestricted access to a personal care team through phone visits, secured messaging, and secured telehealth consultations, including 24/7 access to a provider. Members can see their providers when they need care by getting same-day or next-day appointments. Healthcare spending is decreased due to a low monthly membership fee and no office visit or other healthcare related fees. Members join our non-insurance-based healthcare plan, which is about 40 to 60% lower than most traditional insurance. The one major limitation of DPC medical model is that it offers solely primary care services and basic preventive care services. So what about the care outside the scope of the DPC office? The Empowering Benefits Medical Cost Sharing Healthcare Plan enhances the DPC model by completing the full complement of care with an array of services geared to include every aspect of a patient's healthcare needs. So let's begin with medical cost sharing. For large medical needs, Empowering Benefits offers a proven and effective alternative to traditional healthcare called medical cost sharing. This nonprofit program provides for its members an organized structure within which members contribute towards each other's large medical expenses. There are two types of fees associated with this program: a monthly share fee that is utilized to help pay medical expenses for the community, and an initial unshareable amount, or IUA, which is the responsibility of the member to pay for large medical needs before sharing is initiated. There are three fee levels of IUA from which to choose: $1,000, $2,500, and $5,000. For a large medical need, the member would first pay up to the initial unshareable amount chosen. Any fees in excess of this amount would be shared 100% by the medical cost sharing community with no cap. There are no provider network restrictions for large medical needs, preventive colonoscopy and mammography, or childhood immunizations. As a self-pay patient, you have access to any provider that accepts cash pay patients. There is a 6-month waiting period for preventive colonoscopy and mammography, as well as childhood immunizations. There is a 60-day waiting period for onset of pregnancy. The medical cost sharing community is alternative medicine friendly and accepts for sharing medical costs associated with integrative specialists, chiropractors, and holistic practitioners on approval of the treatment therapy submitted by the provider. The medical cost sharing community recognizes an accident or illness as a medical need. The initial unshareable amount is the only cost which is the member's responsibility to pay before a need is shared. Individuals, couples, or families are responsible to pay up to their IUA amount for a maximum of 3 needs per year. For any further needs, the member is responsible for up to $500. If the expense of that need exceeds $500, medical cost sharing will share that need in full. We'd like to offer an example of how a large medical need would be managed utilizing medical cost sharing. In the following scenario, a member has a heart attack at home and is taken to the ER by ambulance. The member experiences a 5-day hospital stay and receives the following services: an EKG, a surgical procedure, post-surgical physical therapy, follow-up office visits, and is also prescribed medication. The sum of all these services totals $78,250. The member pays only the amount of their IUA, which in this case is $1,000. The medical cost sharing community shares the remaining costs, totaling $77,250. There is a pre-existing conditions clause in the medical cost sharing guidelines. For any pre-existing conditions that the member has shown symptoms for, been diagnosed with, or has been prescribed medication for within 24 months prior to their elected membership start date, year 1 of membership, that particular need is not shared. Year 2, the sharing limit is $25,000. Year 3, it's $50,000. Year 4 and thereafter, the sharing limit is $125,000. For example, if prior to membership, the member was treated for pain in their knee, and within the first year after their enrollment, they required a knee replacement surgery, that need would not be shared by the medical cost sharing community. In membership year 2, it would be shared up to $25,000, year 3 up to $50,000, and year 4 and thereafter up to $125,000. Our telehealth component is the perfect backup solution to your DPC provider's off-duty hours, including nights and weekends. This platform offers continuity of care with updates to your DPC provider on patient status. We provide each member with their own private electronic medical vault to store their medical records. This vault can be accessed by both the DPC provider and telehealth provider to share information about a patient's medical condition. Concierge assistance is key to getting the full benefits of our healthcare plan, and your employees are in excellent hands with our team of highly trained concierge consultants. We will assist your employees in the following ways. At their request, we will confer with them as well as with their DPC provider and assist in coordination of care for specialist referrals. When a provider or member requests us to conduct a referral search, in addition to the primary partner's provider directory, we utilize other reliable sources to search for providers, facilities, and labs offering the highest quality of service and fairest pricing. Once we complete our research, we send the member a list of high-quality, fair-priced specialists or facilities from which they can choose, and we keep the provider updated on this process. Keep in mind that since our members are cash pay patients with the Our Primary Doc plan, they have an open network to access for medical services. We will conduct a welcome call with each new member to explain the OPD array of services, assist the member in accessing these services, and answer any questions they may have. We will continue to guide your employees in navigating their medical needs outside the scope of the DPC services, as well as answer any questions they may have about their Our Primary Doc membership. The concierge team is available Monday through Friday, 9 a.m. to 8 p.m. Eastern Standard Time. For any member surgical needs whose expenses exceed $5,000, our MPB concierge partners with the Blue Book Care Connect team to assist the member with this process. We notify Care Connect, who will be managing this need, and conduct a warm transfer from the patient to a Care Connect team member. From that point, Care Connect researches all the requirements for that surgical procedure, including the surgeon, medical facility, anesthesiologist, and any other services connected with this procedure to find the best quality and fairest price for each component. Care Connect then negotiates these fees to arrive at the lowest surgical bundled price and presents that to the member. If the member accepts this bundled price, they submit it to the medical cost sharing community for approval. Once approved, this surgical fee is paid in full prior to the surgery. All arrangements for the surgical procedure are managed by CareConnect, freeing the member of that responsibility, and the member does not experience any surprise post-surgical bills. Early engagement by the member with our concierge team is crucial to achieve the best outcome and keep medical fees in check. In fact, when a member utilizes our team to research quality of service and fair pricing for a surgical procedure, depending on their IUA amount, that member is eligible for a reduction of $500 to $1,000 off their IUA from the medical cost sharing community. With a high cost of prescription medications, our concierge pharmacy benefit program offers some of the deepest discounts available and is easy to use. The member fills out our form for the medications they need and submits it. Our concierge team then goes to work researching the pharmacies in the member's area that offer the lowest prices for each medication requested. Once their research is complete, they send the member the names of those pharmacies with the pricing, as well as any discount coupons that may be used. From the list of discounted options our concierge provides, the member can decide which pharmacy would best suit their needs. For higher priced medications, we use a service that seeks out lowest pricing for medications worldwide to get the best price possible. They help with high cost maintenance meds like insulin, medicated creams, and asthma inhalers. We also have access to manufacturer savings programs, patient assistance programs, and other savings and discounts offered by pharmaceutical manufacturers. Our employee member assistance program is extremely well received by our members, particularly in times of personal or economic hardship. There are 3 areas of assistance this service offers: mental health counseling services, such as mood disorders, anxiety, addictions, and chemical dependency, which provides 12 virtual or in-person counseling sessions per year. Life work care, assistance, and resources for all of life's daily challenges, such as elder care, child care, housing, financial issues, and legal forms, with 24/7, 365 access. They also offer advanced HR support, consulting, and leadership coaching for employer groups. This is truly an outstanding program that has a potential benefit for everyone. So we've reviewed the major components of the Our Primary Doc healthcare plan. Let's now look at our plan's pricing schedule. As you can see, these plan fees are quite affordable and offer an impressive number of services to encompass a variety of healthcare needs. This pricing is the same for individuals, employees, and association members, with no age banding. So at a $1,000 IUA, pricing starts at $299 for an individual to $795 for a family with 2 adults and 1 child. The fee for each additional child would vary depending on the age of the child. So a child up to age 2 would be $90 per month. From age 2 to 5, $70 per month, and age 5 and older, $40 per month. There is a $50 per month surcharge for tobacco use per membership unit. Here are some tax facts you should be aware of with this program. Our primary doc is a total post-tax solution that is not tax advantage for employees, but the huge savings it affords makes it a very desirable option. The word qualified, as associated with healthcare, refers to its tax status, pre-tax or post-tax, not whether it is compliant or quality rated. Our primary doc includes both direct primary care and medical cost sharing, neither of which are qualified by the IRS, which means that it must be paid for with post-tax dollars. I'd like to share this quote by our CEO, Rod Maxon, because it gets to the heart of what many employers face in developing a top-rate staff. And I quote, "Three common challenges face most employers in offering healthcare: high cost, unsatisfactory quality plans, and time needed for healthcare administration. Our primary doc solves these challenges with a fairly priced, high quality benefit to employees with no administration efforts needed." We also have a quote I'd like to share from Total Family Healthcare, one of our OPD providers, who has enrolled their staff in the Our Primary Doc program. And I quote, "Our primary doc is the most cost-effective way to provide employees with primary care visits and large medical needs. We save over $300 per month per employee with our primary doc versus traditional commercial insurance." So after reviewing the highlights of our primary doc through this presentation and with your OPD advisor, if you would like a proposal, the following are the next steps to take. Step 1, go to opd.health. On that page, you can download the OPD Group List Bill Program Process document, so you'll know what to expect every step of the way. Step 2, select Group Census. After completing the general questions, upload your company census if you have one. If not, use the online tool to create one. Step 3, set an appointment with your healthcare advisor to review your OPD proposal. That concludes our presentation. To learn more about our primary doc, please contact your OPD advisor or call 407-270-3191. Thank you so much for watching, and we look forward to the opportunity to assist your team. And I hand it back over for some Q&A I think we're going to do. Is that right?
If anyone has any questions, go ahead and you can place them in the chat or the Q&A section. I don't have anything offhand. I mean, does anyone have any questions? This information is also going to be available on our YouTube channel that we have. We'll share it that way. So if there was anything that you missed, you can go back and you can see that. And then Joan, would you be able to provide the slide deck that we can share it with the attendees as well?
Absolutely, sure.
Perfect.
We can do that. Right.
Perfect.
And I'd like to say that on behalf of our primary doc, that this is an option, obviously, for employers. It's one option, and the plan is not for everyone. So we do have licensed healthcare advisors that can help other employees who want to research other avenues that feel that they maybe would not be a candidate for this. If they find that they're not, we can help them with other healthcare options. So we want them to know that.
Okay. I'm not seeing any questions at this time. Do you guys have any final thoughts or any final things to share?
Of course, they can call our line, the 407-270-3191 line, and we can, as you say, we can share other information, whatever you feel would be helpful to the members of the chamber.
Great, thank you.
Hey, Joan, this is Denny. I have a question.
Okay.
As for small business owners, are they required to contribute?
No, they are not required to contribute. They can not contribute and have their employees pay the full amount of the plan fee, or they can contribute, as much as they feel they want to, or they can contribute the whole amount.
Thank you.
Yeah, one of the benefits really of the program is the fact that an employer can, first of all, kind of get out of the insurance administration business, as Joan mentioned, but set a fixed amount that they can set up as a program for their employees and not worry about, the guidelines of insurance companies saying, well, you got to pay 50% of the employee only. And next year when the price goes up, you now have to adjust your budget, if you will, as an employer to pay for the benefits. This is a great opportunity to get a fixed amount so that you can go back to paying attention to what you need to do, which is run and grow your business.
Okay, we did have a question come across. If the employer contributes, it will be deductible to the company then, correct?
Correct. Just as any salary would. Correct. Any expense.
Seeing that there's no other questions, we'll go ahead and wrap it up. Thank you all for providing all of this information for everyone, and thank you to everyone that attended. As I mentioned, this will be available on our YouTube channel later today, and then we will go ahead and share the slide deck with everyone. So, oh, hold on, someone, Mary Lou. Go ahead, Mary Lou.
I wanted to ask, how long does it take to get at this new service opposed to what we have existingly, and how long does it take to set people up?
Rod, you want to take that?
Yeah, I could take that. So basically, in order to put one of these programs in place, we've got to have everything completed by someone needs to start the process by the 10th of the previous month that they want to start the program for. And that, of course, depends on the fact that everybody that's involved in wanting to get in the program will go through the enrollment process quickly. But what we do is with every case, the employer is provided with a educational funnel so that when they do have new additional employees join at a later time and they're now qualified for their benefit, they can send them to them at any time. And at the end of the educational funnel is our advisor that is associated with that employer so that they can call and ask any questions. And then the next step when they click submit, they go right to the enrollment platform and go through that process. That whole thing kind of depends on the speed of the consumer, if you will, but we require that we start it by the 10th of the month, and because we have to close it out by the 20th of the month for the beginning of the following month. Now we can add additional people, but we have to close out the process. So does that help?
Yes, thank you. Is there a list of the doctors or whatever that you look at, like you do if you had a primary? Is it pretty much just the virtual and the concierge first, and then you get who you need?
Well, the primary is not the virtual first. The primary is your DPC, and we do have a directory for that of the primary partners doctors that are part of this program. They're all in your general area, and we're building on that. So if there are doctors that we need to add to that in your area, we can. Now, keep in mind that we have been doing this complete program for over 5 years, but we have just formed the partnership with primary partners over the last couple of months. And this is a very unique thing because before this, everybody that had these different components had to pay for all the different components separately. This is the first time that we've been able to take and give you a directory of direct primary care doctors to choose from. And different people in the company can choose different doctors. So there's not that locked in kind of a thing like that. And then as Joan said, that beyond that, it's really an open network. That's the beauty of the program. If you need to go to the Mayo Clinic, well, you go to the Mayo Clinic. I mean, it's the best program for quality service, but we do need everybody that's involved to be personally responsible, to be involved with the program, to use the services so we're able to keep the pricing and everything the way that it is.
I'd like to add something just to focus a little bit. In terms of providers, we also are open if any employee has a primary care physician that they really love who happens not to be in our directory at the moment. We're very happy to reach out to that provider and have them join us as the DPC provider. We will do that. We just need the name of the provider, from the employee, who they're utilizing.
Does anyone have any other questions before we wrap up?
This is Mitesh. What I would like to add is that since this is not insurance, an employer can have this program started anytime and start enrolling employees. So they don't have to wait for an open enrollment period or a particular time of the year to start this.
Thank you, Mitesh. Okay, as I mentioned before, this will all be available later today, and we'll go ahead and get that slide deck out to everyone. Just a couple reminders from the chamber. We do have First Friday tomorrow. It is not at the Claremont City Center. It is at the Arts and Recreation Center in the Claremont room. There should be signage when you arrive, and then go ahead and enter on the south entrance, not the main entrance that you're normally entering through, but the one on the side. So thank you again, Joan, Rod, Denny, and Mitesh for joining us today, and I hope everyone has a wonderful Thursday. Have a great day.
Thank you so much.
Yeah,
Have a
thank
great
you.
day.
Bye.